Hi, good afternoon, everyone. Thank you for joining the second webinar series of Upcom. We will wait for a few minutes before we start so that others can also join in. We are also live in Facebook, so you can go to Upcom's official Facebook page and please do share the live streamed webinar. Thank you.
Yeah, I have one question before that. Inath, can I ask you?
Yeah, sure.
Yeah, I got email today morning also.
Wait. San Sanjay, if you can send me that message in WhatsApp, that would be very good. Hi, good afternoon, everyone. Thank you for joining us today in this afternoon's AppCom second webinar series in partnership with Linkages. We're still just waiting for some few of our participants and some of our speakers to join in. I would ask for a few minutes, 2 more minutes before we can start. Thank you.
Hello everyone.
Hi, Yashwinder.
Hi, how are you?
I'm very good. Welcome.
Thank you.
Welcome, everyone, and thank you again for your time for this afternoon to join APCOM's second COVID-19 webinar series. We are joined today by our community partners in various countries from South Asia, from Southeast Asia, East Asia, and uh, we hope that our communities in the Pacific may be able to join us through our Facebook Live. During the first webinar, we have learned about the innovations or the creative ways that the community-based organizations adopted to address the interruptions which are brought about by the COVID-19 pandemic. This afternoon, we provide a platform for key population communities to highlight what is currently done, what needs to be done more, what is not done, and why are some issues still not addressed. Through this platform, APCOM hopes to define the roles of the community-based organizations in the national responses to COVID-19 and HIV. Also, last Wednesday, if you have received, or if you have in your timeline, you have received, UNAIDS in its report said that countries need to build COVID-19 responses rooted in respecting human rights, hearing from the most marginalized. And we are very honored to have our colleagues from UNAIDS also joining us for this webinar. To our partners in Thailand, Sawasdee Krap. To our partners in Burma and Myanmar, Dingalaba. And I'm very happy to share that the Myanmar Positive Group in Myanmar is hosting, observing safety protocols, is hosting the community network representatives from different key population networks in their office in Yangon. So, Dingalaba, everyone. And to our partners in Indonesia, Salamat Datang. Nice to see you. And to our partners in Nepal, Namaste. We are joined by our speakers from Thailand, from M+, from Myanmar Youth Stars in Myanmar. We have the Jaringan Indonesia Positive from Indonesia and Blue Diamond Society from Nepal. May I invite in M+, if you're here. Okay, so let's jump over to Myanmar to share what is the current capacity of the organizations in Myanmar and what has been the effect of COVID-19 response in the operations of the community-based organizations. May I invite Dr. Mintet Kyosan from Myanmar Youth Stars to please share your points.
Hi, everyone. So thank you very much to APCON for organizing this important webinar. So I am delighted and honored to be invited to speak on behalf of community organizations in Myanmar at this important webinar. So regarding the topic that how we intensifying capacity strengthening during this COVID. So COVID pandemic has greatly affected socio-economic status of marginalized populations in Myanmar due to either loss of their job and reduced income, and also concerns on their own head are creating anxiety among the community. So as Inet mentioned before, UNAIDS reported there are interaction to HIV services and disturbing human rights violations against marginalized populations. The experience of the response to HIV has proved that violations of human rights during pandemic undermine trust and individual and separate public health response. So globally, COVID-19, as you all know that COVID-19 adversely impacting our program, operations, and services. Most of the organization has stopped the outreach and physical activity. And it's also affected our funding levels and ways of delivering services and our internet operation as well. So many community organizations have changed the way of their work during these few months. So it is great to, in Myanmar, it is great to observe that all the different sectors, including government, UNAs, NGOs, community organizations, put strong effort on COVID and HIV response. So community representatives work closely with government for contingency plan development for HIV, with the leadership of national AIDS programs and all partners before the crisis happened in Myanmar. So this plan provide guidance and ensure clients on ART to assess minimum 3 to 6 months supplies of ARV by both public and NGO facility. So ARD dispensing services are being carried out by the National AIDS program for cross-border ARD clients at Myanmar Thai borders. So by the end of June 2020, we have achieved that over 60% of people living with HIV on ARD have been received 6-month ARV supplies. And also it's glad that to see some organizations involved in COVID emergency response, such as COVID prevention, volunteering at quarantine center, providing food support and financial support for key populations, and receiving migrants at border area and linkage to ARD treatment and care. As a new normal, so community need to adapt with the use of the technology in terms of communications and delivery HIV prevention services. We have tried to adapt for virtual communication, including online conference, online training and workshop, and online survey, etc. So, but most of the organization not have technical capacity to carry out work remotely. So as a new capacity, community need to provide with the training on how to use the virtual communication tools and online social media. For adaptation to COVID-19, we need training on COVID preventive measures such as PPE should also provided for those who are working as peer volunteers at facilities and in the fields. And community also needed technical input on how to reprogramming their activity to, because sometimes most of the community organization are lack of the technical for how to reprogramming issue. So as there is scarce opportunity for rapid response grants, only few organizations in Myanmar could receive funding support for COVID response. And also most of the proposals set the selection criteria and requirements such as the proposal need to be English language, and send donor not allowed to apply by new partner. So this is really a major challenge our community facing to applying the call for proposal. So currently, CBOs and community networks in Myanmar in a state of preparing for performing the gas in service provided by NGO as the effect of the international fund and investment decline in Myanmar. So our community member demand the questions on why community organization could not provide services and support needed during this COVID era, and why we cannot address our community concern during this time. So as the next step, we need to find out the local solutions, how to maintain continuations of community-led services, and how can we make the capacity strengthening as well. And we understand that the organizational developments with the leveraging support from UNs and NGO needed for community organization during this transitional periods as well. Therefore, we need continuous support from UN agency, NGOs, governments in terms of technical guidance, capacity strengthening, and funding support in order to put in place for the role of community-led and to be ready for the next global fund rounds in Myanmar. So currently in Myanmar, only one of the community organization accept as a sub-recipient and GF. So we need more SR and SSR among the community organizations. So in this COVID era, we recommend for expanding more digital health services and solutions and other alternative ways and innovative approach to provide services for key populations to avoid disruption to HIV-related and health services, including multi-man dispensing for ART, methadone, and implementing HIV self-testing urgently and combination prevention for HIV as well. So as the last point of my speaking note, we would like to highlight to provide more rapid response grant and support on capacity strengthening in COVID era in order to address the community needs in time. So thank you.
Thank you, Dr. Mintatyo-san. So I just want to re-echo what you said earlier, that this the one that you're just saying now is a collection of the community voices from the different key population networks in Myanmar. Is that correct?
Yes, yes, that's
so,
correct.
yeah, which are currently hosted by the Myanmar Positive Group Office at the moment. So Dr. Mint said that the communities need online capacity or the capacity in IT, support for PPE and technical inputs or technical support in reprogramming or the capacity to reprogram programs which are affected by COVID-19. And also there is a major challenge for CBOs in Myanmar because there is a limited opportunity to seek support in funding. And they need to be ready for the next Global Fund country processes, and also making sure that there is an expansion of health services to online, including management of ART dispensing, HIV self-testing, PrEP, and also calling for a more rapid response grant for community-based organizations. Thank you so much. We will have a time for questions and answers for our participants in this webinar. Now may I call on Mirinda Sebayang from Jaringan Indonesia Positive to share your thoughts. May?
Hello, Inat. Thank you so much. Thank you for introducing me, and thank you to APCOM for inviting me to this webinar. Hello and good afternoon, everybody. Let me start by telling you a story of a friend during the COVID-19 pandemic. I've been permitted to tell her story to all of you at the meeting this afternoon. We used to call her Mami Dince. Maybe some of my colleagues from Indonesia also know her. I asked her permission last night and she gave me permission to tell her story to all of you. So she's a transgender woman and works as a salon worker, specifically for makeup, or can be called a makeup stylist. So since the COVID-19 pandemic in Indonesia around March 2020, the imposition in large-scale social restrictions by the government, the salon business has been closed by the salon owner. So she has also lost a source of income to support her daily life. In fact, in addition to food and daily necessities, the income is used to regularly pay for accessing medical treatment at health services. Mami Dince said at this moment, she's doing odd jobs and sometimes help her relatives with only minimal payment. Mami Dince admitted that she was only able to earn around $2 or $3 per day in the last few months from this odd job. And by doing odd jobs, she admits that she experienced high anxiety because she has to work outside the home. She is worried that she will catch COVID-19. Since the impositions of large-scale social restrictions, she has received food aid from the local government and also from the community-based organizations that have raised funds to provide food support to the transgender community around Jakarta area. Unfortunately, the support was not routine and she still had to work hard to meet her daily needs. The money she gets from odd job, she spends on buying side dishes and pays for transportations and health costs if she has to go to the healthcare. Mami Dince is one of the thousands of stories that represent key population friends whose lives have been disrupted and made worse by the COVID-19 pandemic. I believe there are still many unlucky stories which have not been told, experienced by other key populations, including story of sex workers, men who have sex with men, injecting drug users, and transgender people whose lives are exacerbated and very vulnerable to contracting COVID-19. In mid-August 2020, this month, our organizations, Jaringan Indonesia Positive, or the Positive Indonesia Network, has conducted a second survey regarding the needs and impact of COVID-19 on people living with HIV in Indonesia, with the implementation of new adaptations or the so-called new normal in our country. UNAIDS and WHO Indonesia support this survey, and it's a follow-up survey from the first survey we conducted at the initial of the pandemic in March 2020. The survey succeeded in obtaining information from 1,035 people living with HIV from all provinces in Indonesia, from 34 provinces all over Indonesia. And currently our team is conducting analysis and completing the survey results, and we plan to disseminate the survey results very soon. But for you, INAT, and also APCOM, on occasion this afternoon, I would like to share some essential preliminary findings from the follow-up survey results. From the result, it shows that 44.3% of respondents lost their income source, and 45.8% of respondents were unable to meet food needs for themselves and or their families. In addition, 19.3% of respondents were unable to continue paying rent for housing, and only 28% of respondents received social support from the government. With these figures, I have to acknowledge and realize that Indonesia is one of many countries, other Asian countries, which clearly show that the COVID-19 pandemic has impacted the socio-economic situation for people living with HIV and also key populations. And this is certainly for sure has implication for access to the necessary HIV treatment and also prevention services. Another fact that I want to convey is, since May 2020, as many as 6,428 people living with HIV are screened for COVID-19. 1.8% are reactive, and from them, 11% have died. And these data were obtained from the Provincial Health Office, compiled by the Ministry of Health, and was presented at the meeting in August together with the country team of the Global Fund for Indonesia. Several factors, of course, can put people living with HIV and key population at a higher risk of contracting the coronavirus. Key populations and PHIV are vulnerable due to high mobility and also close physical contact with other people through social and or sexual practices. And then, people living with HIV who are not on antiretroviral therapy and the viral load still detectable may have compromised immune system, which can put them at a higher risk of contracting the coronavirus and increase morbidity and mortality related to COVID-19. And for me, this risk seems reasonable, especially since the number of people living with HIV in Indonesia who already on treatment is only at 25%. And the loss to follow-up rate in our country is around 21%. And the frequent issue of stock out of ARV in health services is making the situation worse. So then the next question is, how can we ensure protection, safety, and health for people living with HIV and key population amid an outbreak? How we can achieve the HIV elimination in 2030? I want to speak about the declarations of human rights. I want to remind everybody about the Universal Declarations of Human Rights that has mandated the states to fulfill the fundamental rights of its citizens, including the right to health, the right to social protections and adequate standard of living, and the highest attainable standards of physical and mental well-being. And people living with HIV and key population whose lives have been greatly affected by COVID-19 clearly need support to fulfill their fundamental rights. And these needs include protecting them from COVID, support for safe and sustainable linkages to HIV services and prevention commodities, including inclusive social support due to COVID-19, such as food provisions for those unable to work due to the lockdowns. Unfortunately, until now, the support for the HIV program, especially those that come from government support and our biggest funder, the Global Fund, has not really touched the needs that are really needed by key populations and also people living with HIV who are most affected by the COVID-19, especially related to the social support or their basic needs. And the other question is, how can we ensure that the HIV program will be successful? How can we ensure reaching 90-90-90 if we are not trying to meet the basic needs of those in needs? So, in a sense, and I have quoted these words from the UN's Twitter this afternoon, we need to build COVID-19 and HIV responses rooted in respecting human rights and hearing from the most marginalized. We need a strong or robust commitment and support for them during this pandemic by developing the most effective and targeted intervention based on their needs. And this commitment, of course, includes continuing to make sound investment in COVID-19 and HIV program with human rights and gender perspective. I believe we know what is working. I believe we know what to do, and we understand that a right-based approach must spearhead our efforts towards our ultimate goal of zero new infections, zero discrimination, and zero AIDS deaths. Strengthening the rights for those who are stigmatized, it should be and must remain of our strong commitment. Thank you, everyone. My name is May. I'm the chair of the Positive Indonesia Network or Jaringan Indonesia Positive. Over to you, Inat.
Thank you, May, for that information, for that experience. And I really appreciate that you have shared. Well, I'm pretty much sure that that there's some emotions there coming from you, coming from the key populations ourselves. ATCOM did a rapid survey last April when the COVID-19 pandemic broke out, and we did find the same findings: the loss of income for some of the key populations, and resulting not to meet their basic needs, and also them being forced out or evicted in their accommodated spaces. And the data that we have presented just shows that what we found at the regional level really reflects heavily on what is happening at the country level, particularly on the key populations, especially the people living with HIV. So you raised about the social support, continued social support, especially on the basic needs of the key populations, inclusive support for how to make sure that we are meeting the basic needs of the key population, the HIV, so that we can achieve 90-90-90. And you are very much highlighting that this should be human rights based. And if you would permit me, I would share that you have shared before that this year, during the Global Fund processes, the process happened during the COVID-19 pandemic. And there were a lot, you did propose for some of the solutions, but got rejected, correct? Okay.
Yes, not approved yet.
Not approved yet, okay, so not rejected, so sorry, not approved yet for the.
Well, actually it's rejected, but I want to sound more soft, so not
Diplomatic.
yet, because we will push these needs to the Global Fund and also to the government. Yeah.
Thank you, May. Again, we are live on Facebook. I want to hug you, virtual hug. We are live on Facebook, and please do share our live stream to your Facebook accounts. Thank you so much, May, and to Dr. Minta Tiosan for your sharing. Now we move on to the different side of Asia, to South Asia, where our friend from Nepal, Sanjay Sharma, who is working for Blue Diamond Society, will be sharing his insights on the roles or the participation of the community-based organizations in the country processes. Sanjay, namaste. Sanjay, are you here?
Yeah, namaste, Inat.
Namaste. Okay, the floor is yours.
Yeah, and thank you so much for the INAD and AppCom team for giving opportunity to share our experience with the engaging community-based organization and community people in global fund processes and the PEPFAR processes. And all over the country of Nepal in different provinces, because in 2015, in the constitution decided Nepal to have a province level government, local level government, and federal level government. So we are working in our province level, especially for the HIV program. Before that, we have started from the Global Fund grant, which is the Save the Children is PR from the national grant. And we are working with the Save the Children a long time back. And recently, last year, we had decided in October, November, PEPFAR is going to take over the HIV program for the 20 districts. But for the first phase, they had taken over like 13 district program from the Save the Children to FHI, to PEPFAR project. And we work with them, and last 2020 March to September, we have agreed with working with the district level program with the PEPFAR project for HIV prevention and care and treatment and index finding cases. And 7 districts is left, which is covered by regional grant of HIV Save the Children program. But now from this 2020 October, all 20 districts program will be taken over from the PEPFAR project through HIV program of MSM and DG in Nepal. This is our scenario to PEPFAR project. And now the country process of country proposal developing process, which started in the pandemic COVID-19. We have a different consultation meeting, and CCM Nepal provided us support, logistic support to organize virtual consultation meeting with different regions and different province level community for the country country proposal process. So we have a province level consultation with community, and we have some inputs and recommendation for the consultant who is working for the Global Fund grant, Global Fund proposal. And we give some inputs and some our thoughts in the proposal. After that, FHI PEPFAR have some restriction. They have working for their districts level, but 2 districts are left, like Saptari and the Siraha district is left. And at the time, we are very worried how we can continue those districts, because those districts are very, HIV prevalence is very high, and they are Tarai highway district. And later on, we wrote the email to CCM Nepal and FHI and NCSC, and CCM Nepal facilitated the role to organize meeting with the technical partners, USAID, FHI, CCM, NCSC, UNAIDS, and they all together have a one meeting, and also the director of National Center. And at that time, we talked about our issues, which is the district is going to be left 2 districts. So to be continue, because if there is a gap, its HIV prevalence would be high. Then after the meeting was very fruitful, and CCM and USAID FHI linkages project have very good supportive words, and also the National Center Director, Dr. Sudha, also played a very good role to continue to those districts also with a small scale of the program. So now we are fine, and we are working with the PEPFAR project this year up to September, and then again the contract will be from October to another September 2021 September for 1 year. And we are working for that, and for lubricant and the condom support is not in FHI, so we put in our Global Fund grant proposal, country proposal we talk with the consultant and also CCM should be continue from the logistic things from them. These are our updates in PEPFAR and our Global Fund grant. Thank you.
Thank you, Sanjay. Now, we are very happy that our partner from Chiang Mai, Thailand has joined the webinar. And we want to ask Kun Kob Kap. Kun Kob, are you there?
Hello.
Hi, Sawadee Krap.
Sawadee Krap.
Thank you for joining us. Kun Kob will be presenting the good practices of the M+, an organization or community-based service delivery based in Chiang Mai, Thailand. And he will deliver it in Thai, but he will be assisted by our friend Kun Paisan, who will be translating it in English. Kun Kob Kap, you can start sharing.
โอเคครับในช่วงสถานการณ์โควิดที่ผ่านมานะครับก็การทำงานของ M+ นะครับเกี่ยวกับเรื่องของการป้องกันหรือว่ามาตรการต่างๆนะครับแล้วก็มันเชื่อมโยงยังไงกับเรื่องของการทำงานด้านการตรวจ HIV นะครับผมก็จริงๆแล้วเนี่ยต้องบอกว่าสถานการณ์โควิดที่ผ่านมาเนี่ยมันส่งผลกระทบทุกๆส่วนอยู่แล้วเลยครับทั้งเรื่องของภาพรวมของเศรษฐกิจต่างๆแล้วก็เซอร์วิสหรือว่าบริการต่างๆเนี่ยมันก็หยุดชะงักลงนะครับในส่วนที่ M+ ทำงานโดยตรงเลยก็คือเป็นเรื่องของประเด็นสุขภาพก็คือเรื่องของ HIV นั่นเองนะครับ
Good afternoon. I will be speaking on the impact of COVID-19 on M+ work in the HIV prevention. During this COVID-19 crisis, the pandemic has heavily impacted on the country's economy as well as the service delivery that M+ has been conducting. เช่นครับ
ผมสำหรับมาตรการในการป้องกันเนี่ยจริงๆก็เป็นเรื่องของมาตรการที่ทาง M+ เองเนี่ยได้ข้อมูลมาจากองค์กรที่เลี้ยงไม่ว่าจะเป็นจาก FHI เองหรือว่าจากทางการชาติเองเนี่ยที่มีการสนับสนุนเรื่องขององค์ความรู้เกี่ยวกับเรื่องของโควิดต่างๆครับก็มันเลยทำให้เกิดการออกแบบพัฒนากิจกรรมแล้วก็บริการต่างๆที่มันอาจจะต้องมีการป้องกันนะครับอย่างเช่นเรื่องของเซอร์วิสภายในคลินิกที่เราเปิดให้บริการครับคือ M+ เนี่ยทำงานเรื่องของ prevention ใช่ไหมครับก็คือไปค้นหากลุ่มประชากรที่มีความเสี่ยงเกี่ยวกับเรื่องของ HIV เนี่ยให้เขาเข้าถึงบริการด้านของการตรวจการรักษาโดยเร็วครับซึ่งเราเองก็มีคลินิกเกี่ยวกับเรื่องของการตรวจ HIV นะครับให้บริการด้วยครับ
As M+ works in HIV prevention and community outreach, we also have our community clinics. So based on the preventive knowledge against COVID-19 that we have gathered from FHI and the Thai Red Cross, we have designed activities to prevent COVID transmission within our community clinics. เช่นครับ
ครับคือต้องบอกว่าพอเราให้บริการเกี่ยวกับเรื่องของสุขภาพครับมันเหมือนกับเป็นหน่วยบริการสาธารณสุขหน่วยนึงนะครับที่ถึงแม้สถานการณ์โควิดมันจะเข้ามาณตอนนั้นครับมันก็ไม่สามารถที่จะปิดให้บริการได้ครับคือก็คล้ายๆกับโรงพยาบาลอะไรเงี้ยครับซึ่งก็ยังจะต้องดูแลคนป่วยอยู่นะครับ M+ เองเนี่ยก็ได้มีการเปิดให้บริการโดยที่เราไม่ได้มีการเรียกว่าแบบลดวันให้บริการลงนะครับแต่ว่าก็ยังเปิดให้บริการตามปกติแต่ว่าเราก็ใช้มาตรการต่างๆอย่างเช่นเรื่องของการเว้นระยะห่างหรือว่าใช้ระบบต่างๆเข้ามาช่วยในเรื่องของการจัดการของเซอร์วิสเลยครับอย่างเช่นเรื่องของการจองคิวการตรวจสุขภาพออนไลน์มาเพื่อที่จะช่วยในเรื่องของการจำกัดคนที่จะมาใช้บริการในแต่ละวันในแต่ละชั่วโมงนะครับเพื่อให้เราสามารถบริหารจัดการผู้คนได้ครับไม่แออัดในสถานที่ที่เราให้บริการครับผม
As we operate our clinics In the same way as other government healthcare facilities, we cannot close our clinics and stop serving our patients. So we continue our operations as normal and used different measures such as social distancing and online booking in order to limit the number of clients in the clinic at any given time, and also to reduce crowding within the facility.
ครับเราใช้เว็บไซต์ที่เรียกว่าเว็บTest Me Now ครับซึ่งจะเป็นเว็บที่จองคิวเข้ารับบริการออนไลน์ซึ่งในเว็บนั้นเองครับก็จะมีเรื่องของการจำกัดเวลาใน1ชั่วโมงครับสามารถให้บริการได้กี่คนเลยครับอันนี้มันก็จะช่วยเรื่องของการวางแผนตัวของเจ้าหน้าที่ที่จะให้บริการครับว่าภายใน1ชั่วโมงนั้นใน1วันนั้นเลยครับเขาจะต้องให้บริการกับผู้รับบริการกี่รายโดยในช่วงสถานการณ์โควิดที่ผ่านมานะครับ MPAS เองเนี่ยเปิดให้บริการเฉพาะผู้รับบริการที่จองคิวออนไลน์มาเท่านั้นครับเพื่อช่วยเรื่องของการจัดการด้านปัญหาต่างๆแล้วก็รวมถึงการทำงานเรื่องของการเข้าถึงกลุ่มเป้าหมายในพื้นที่ครับกลุ่มประชากรหลักที่เราดำเนินงานก็คือจะมีทั้ง MSM TG MSW TGSW เลยครับในพื้นที่ซึ่งพอสถานการณ์โควิดมันเข้ามาเนี่ยครับมันก็อาจจะทำให้สถานประกอบการต่างๆแหล่งรวมตัวเลยครับปิดไปครับเราก็มีการปรับเปลี่ยนแผนในช่วงสถานการณ์นะครับก็มีการเน้นเรื่องของการเข้าถึงการทำงานผ่านช่องทางออนไลน์เพิ่มมากขึ้นเพราะว่าเป็นช่วงที่คนเนี่ยคลุกคลีอยู่กับออนไลน์ครับเพราะฉะนั้นแล้วเนี่ยงานลิสต์งานเข้าถึงกลุ่มเป้าหมายเนี่ยก็จะไปเน้นเรื่องของการเข้าถึงทางออนไลน์มากขึ้นมีการวางแผนมีการออกแบบกิจกรรมในออนไลน์ครับผม
So in terms of the clinic services, we use a website called Test Me Now for online booking, and which can help us to limit the number of clients during the operation hours, and also help our employees to plan their service delivery accordingly. And in terms of the outreach, because we serve the key populations such as the MSM, TGs, male sex workers and female sex workers, during the COVID-19 crisis, their working venues are closed, so we cannot conduct our outreach activities as normal. And so we shift our outreach activities to online outreach, which is how our key populations are spending most of their time during this crisis.
จากการใช้ทั้งระบบเรื่องของการจัดการเข้าถึงกลุ่มเป้าหมายครับผมแล้วก็มีการปรับเปลี่ยนแผนการทำงานออนไลน์เพิ่มมากขึ้นมีการนำข้อมูลในช่วงของการทำงานช่วงโควิดนะครับมาวิเคราะห์ทุกๆเดือนเลยครับในเรื่องของการเข้าถึงนะครับก็เราก็พบว่าผู้เข้ารับบริการที่มาใช้บริการที่คลินิก MPAS เนี่ยครับไม่ได้มีจำนวนที่ลดลงกว่าช่วงระยะเวลาปกติเลยเรายังสามารถให้บริการได้อย่างเต็มที่แล้วก็ผู้คนที่เข้ามารับบริการนะครับยังมีจำนวนที่เรียกว่าแบบมีความมีปริมาณที่มันพอๆกับช่วงที่สถานการณ์โควิดยังไม่รุนแรงครับผมซึ่งก็เกิดจากการที่เราเอาข้อมูลนะครับมาวิเคราะห์ทุกๆเดือนอย่างเช่นเรื่องของการช่วงที่ผ่านมาเนี่ยพอเราบอกว่าเราทำงานออนไลน์100%ก็คือแบบเข้าถึงผ่านช่องทางออนไลน์เลยครับเราก็มีการนำเอาข้อมูลในออนไลน์ครับมาวิเคราะห์ดูว่าการเข้าถึงผ่านช่องทางออนไลน์เนี่ยเราสามารถเข้าถึงกลุ่มประชากรที่เขามีความเสี่ยงเนี่ยมาจากช่องทางไหนบ้างครับซึ่งอันนี้ก็เป็นประโยชน์ให้กับทั้งตัวเจ้าหน้าที่เองให้กับองค์กรเองในการที่จะนำข้อมูลเหล่านี้ครับมาวางแผนออกแบบกิจกรรมหรือว่าเลือกช่องทางที่เราจะเข้าถึงเพื่อให้มันประสบความสำเร็จแล้วก็ใช้งบประมาณอย่างคุ้มค่าในช่องทางเหล่านั้นนี่ครับผม
So as now we have shifted our outreach activities to 100% online outreach, we have gathered a lot of information and data which we analyze monthly so that we can identify the risk of the populations as well as design appropriate activities for the outreach and we have found that the number of clients have not significantly decreased in terms of those who seek our services through the online booking at our clinic.
ครับอย่างที่บอกว่าคือเรามีคลินิกที่ให้บริการเกี่ยวกับเรื่องของการตรวจ HIV เพราะฉะนั้นเนี่ยก็จะที่คลินิกนะครับก็คือตรวจแล้วก็จะสามารถทราบผลได้เลยนะครับเรามีกระบวนการทำงานที่ผ่านมาครับก็คืออย่างยาวนาน4-5 ปีที่ผ่านมาครับก็คือทำงานเริ่มเชื่อมกับโรงพยาบาลในการที่จะพัฒนาระบบส่งต่อเข้าสู่การรักษามันก็มีโมเดลมีเซอร์วิสต่างๆที่มันเกิดขึ้นมาอย่างต่อเนื่องครับอย่างเช่นเรื่องของsame day ART ที่พัฒนาร่วมกับโรงพยาบาลเครือข่ายในจังหวัดเชียงใหม่ที่จะทำให้ผู้รับบริการที่มีผลเลือดเป็น positive นะครับเข้าถึงการรักษาโดยเร็วหรือว่าเรื่องของDSD ก็คือการที่โรงพยาบาลนะครับให้ยาเอามาจ่ายที่ศูนย์สุขภาพชุมชนนะครับในเคสที่แบบมีไวรัสโรตาเพสแล้วมีสุขภาพที่แข็งแรงซึ่งอันเนี้ยก็เป็นสิ่งที่เอามาเข้ามาช่วยในช่วงของโควิดเหมือนกันครับก็คือว่าเคสที่มีผล positive เนี่ยเขาสามารถเข้าถึงการรักษาได้โดยเร็วโดยที่ไม่ต้องไปใช้ระยะเวลาอยู่ในโรงพยาบาลนานหรือว่าต้องรอหลายๆวันเลยครับก็มีการประสานงานกับ HIV โคแต่ละโรงพยาบาลถ้าเกิดว่าจะมีการส่งต่อเคสก็จะพยายามใช้เรื่องของ same day ART เข้ามาช่วยหรือว่าเคสที่ไวรัสโรตาเพสแล้วนะครับก็เราก็จะมีการโรงพยาบาลนะครับก็จะพยายามที่จะแบบเหมือนแนะนำกับเคสนะครับว่าสามารถที่จะกลับมารับบริการที่ศูนย์สุขภาพชุมชนได้โดยเจ้าหน้าที่ที่ให้บริการจ่ายยาต้านแทนคุณหมอที่โรงพยาบาลหรือว่าแทนเภสัชที่โรงพยาบาลนะครับก็ได้รับการผ่านการฝึกอบรมการเทรนมาอยู่แล้วมีข้อมูลความรู้เกี่ยวกับเรื่องของยาต้านข้อแนะนำต่างๆแล้วก็การติดตามผู้รับบริการเนี่ยครับซึ่งอันนี้ก็เข้ามาช่วยในช่วงของสถานการณ์โควิดนี้ได้เยอะเลยครับผม
As MPlus has been working over the past 4-5 years to develop new innovative measures and techniques in collaboration with the hospitals, Chiang Mai Hospital, to develop new measures such as same-day ART to allow positive clients to receive ART on the same day that they get tested, or the distribution or the dispensing of ART through local community clinics. These measures allow our clients to skip queuing at the hospital or spending a long time at the hospital, and also they can receive their ART at the community clinics whose employees or the community workers have been professionally trained with appropriate knowledge to dispense these ARTs. So these developed techniques and measures have helped MPlus to continue our effective intervention during the COVID-19 in collaboration with the coordinators at the hospitals and other government healthcare facilities.
ครับคือนอกจากงานที่เกี่ยวกับเรื่องของ HIV แล้วครับมันก็ยังมีงานเรื่องสุขภาพอื่นๆหรือว่างานที่เราทำควบคู่ไปด้วยอย่างเช่นเรื่องของการตีตาการเลือกปฏิบัติเลยครับผมก็MPlusเองเนี่ยก็มีโปรเจกต์ที่ทำเกี่ยวกับเรื่องของการลดความรุนแรงในเด็กและเยาวชนอะไรเงี้ยครับผมเราก็จะเห็นว่าในช่วงของโควิดเองเนี่ยMPlusเองเนี่ยก็มีการพูดคุยกับทางแหล่งทุนแล้วก็ขอมีการแบบปรับเปลี่ยนกิจกรรมเพื่อให้สอดคล้องกับช่วงสถานการณ์นี้ครับก็ภายใต้งบประมาณของ AJWS นะครับก็มีการนำเสนอข้อมูลเกี่ยวกับเรื่องของโควิดแล้วก็ได้รับงบประมาณนะครับที่เอามาช่วยในเรื่องของการจัดซื้ออาหารแห้งต่างๆครับเข้าไปช่วยเหลือนอกจากกลุ่มเป้าหมายหลักของโครงการที่เราทำก็คือเป็นเด็กและเยาวชนที่เป็น MSM ในสถานศึกษาต่างๆหรือว่าอยู่ในพื้นที่ชนบทเลยครับผมจากโครงการนี้ครับก็ได้เข้าไปช่วยเหลือทางครอบครัวเขาด้วยในเรื่องของโควิดแล้วก็มีการผลิตสื่อ เอาข้อมูลความรู้เกี่ยวกับเรื่องของการป้องกันนะจะต้องทำยังไงบ้างเนี่ยครับผมอันนี้ก็ใช้งบประมาณในช่วงนั้นอย่างคุ้มค่าแล้วก็รวมถึงทางแหล่งทุนอื่นๆเองที่เราทำงานแหล่งทุนที่แบบเกี่ยวกับ HIV โดยหลักอย่างเช่น USAID เองหรือว่าทาง Global Fund เองเนี่ยครับผมก็มีการหยิบยื่นการช่วยเหลือในช่วงสถานการณ์โควิดครับทั้งเรื่องของเป็นเรื่องของอุปกรณ์เรื่องของชุดข้อมูลความรู้ต่างๆหรือว่าสื่อต่างๆเนี่ยครับผมก็มีการผลิตส่งต่อมาให้มาตรการในการป้องกันเนี่ยครับผมถือว่าเป็นช่วงที่เราได้ช่วยเหลือกันแล้วก็ทั้งแหล่งทุนเองพาร์ทเนอร์เองเนี่ยเราก็ไม่ได้ทิ้งกันหรือแม้แต่ภาครัฐในพื้นที่เลยครับคือด้วยความสัมพันธ์ที่ดีมาอย่างต่อเนื่องเนี่ยครับก็จะมีการซัพพอร์ตข้อมูลกันอย่างต่อเนื่องว่าช่วงนี้จะต้องทำอะไรที่ควรจะต้องระวังอะไรครับก็จะได้รับข้อมูลหรือว่าการอัปเดตข้อมูลข่าวสารเกี่ยวกับของโควิดเนี่ยครับในจังหวัดเชียงใหม่เองเนี่ยก็จะมีกลุ่มไลน์ที่แบบมีสสจอยู่ด้วยมีสคลอยู่ด้วยนะครับผมหรือว่าโรงพยาบาลอยู่ด้วยเนี่ยก็จะมีการส่งต่อข้อมูลว่าโอเคตอนนี้อัตราการติดเชื้อโควิดมันอยู่ที่เท่าไรแล้วพื้นที่ไหนเสี่ยงครับผมคนทำงานในช่วงนั้นนะครับเราในฐานะเจ้าหน้าที่ชุมชนที่ยังจะต้องให้บริการอยู่นะครับเราก็รู้สึกว่าเราสามารถเข้าถึงข้อมูลแล้วก็สามารถที่จะป้องกันตัวเองได้ครับ
Also, in addition to HIV prevention, M+ also conducts program on ending stigmatization and discrimination, as well as violence against children and youth. We have been in discussion with our funders, including AJWS, the American Jewish World Service, to seek funding to provide food for MSM children and youth, as well as those in rural areas and their families. And this has been granted, and we also have developed and provided information materials on the prevention of COVID-19 to our key populations with support from USAID and Global Fund. So during this crisis, we have maintained our close collaboration and mutual support with our funders, our partners, and government agencies throughout the crisis. And we also have established a line group which have participation from the provincial health officer as well as the officer of the Department of Disease Control. And through the line group, we have been constantly updated on the number of COVID cases in Chiang Mai province as well as the risk areas, so that our officers who continue to serve the population can be prepared and prevent themselves from COVID infection.
Apologies to interrupt Kun Kob Kap and Kun Taisan, but let's wrap up the presentation from your side. Thank you.
ครับ
ครับ
เหลือเยอะไหมครับอาจจะเวลาไปแล้ว
จริงๆก็ไม่เยอะแล้วครับพี่คืออาจจะพูดถึงเรื่องของการรูปแบบการพัฒนางานครับในช่วงนั้นครับว่าจริงๆแล้วเนี่ยเรามีการวางแผนแล้วก็ออกแบบกิจกรรมให้มันสอดคล้องกับสถานการณ์ก็คือเรามีการปรับเปลี่ยนเรื่องของงานลิสต์ครับผมจากการลงไปในพื้นที่ครับผมเรามีการเข้าถึงผ่านช่องทางออนไลน์มีการพัฒนารูปแบบการเข้าถึงมีการทำงานแล้วก็ออกแบบกิจกรรมออนไลน์ก็คืออย่างช่วงโควิดเนี่ยเราก็มีกิจกรรมคอนเทสต์มีกิจกรรมต่างๆในเพจที่เราจัดในรูปแบบของออนไลน์ซึ่งก็เป็นองค์กรแรกๆที่ทำเกี่ยวกับเรื่องของอีเวนต์ออนไลน์แล้วก็เราพบว่าตัวเลขของการเข้าถึงของเราเนี่ยมันไม่ได้ลดลงเลยจากสถานการณ์ปกติครับผมก็คือเรายังสามารถเข้าถึงได้เท่าเดิมหรือว่าอาจจะเยอะขึ้นด้วยซ้ำครับผมในช่วงสถานการณ์โควิดแต่ว่าเน้นมีการปรับเปลี่ยนช่องทางรวมถึงเราเข้าถึงเคสไฟดิ้งได้สูงขึ้นจากช่องทางออนไลน์ที่ผ่านมาด้วยครับผมเพราะว่าพอทำงานออนไลน์กันเพิ่มมากขึ้นเราก็จะได้กลุ่มเป้าหมายที่มันเป็นกลุ่มเป้าหมายใหม่ๆที่เราสามารถเข้าถึงได้ครับผมอันเนี้ยก็เป็นสิ่งที่ดีที่เราอาจจะต้องเอาบทเรียนตรงนี้ครับเอามาพัฒนา ต่อไปครับผม
ครับจบแล้วใช่ไหมครับ
ครับผม
Okay. So from our experience during this COVID crisis and activities and events that we have designed to respond to this crisis, we have found that our reach has increased as well as the case finding has also increased once we have shifted to online outreach because a lot of people have more time to spend time online, and we also managed to reach out to new clients. So these are intriguing findings, and we should also utilize this in order to reach out to more key populations. Thank you.
Thank you so much คุณขอบขอบคุณครับคุณไพศาลครับขอบคุณครับ Thank you so much to our community partners in sharing the experiences and the call for support. So we have our partners from Myanmar or Burma, from Indonesia, from Nepal, and from Thailand sharing the experiences from the ground. Before we move on to our Q&A, we now go to our second session where we have invited guests to provide commentaries. We have Steve Mills, the Regional Director of Linkages in EPIC, Thailand and Laos, for us our first commentary. And then we have Roger Tatod from the Deputy Director of HIV Programs from International AIDS Society. And the third one will be our very own Midnight Punkaset Watana. Steve,
Yeah, thanks so much, Enad, and special thanks to Midnight and ABCOM for hosting this session, which really allows all of us to get together and hear these community, I think both challenges as well as innovations, because really what I was struck by, first of all, was the resiliency of so many of your community organizations that have really stepped up to address issues related to HIV, the combined issues related to HIV and COVID, especially to hear about how organizations have used social media even more to reach people, to connect them with testing and treatment services, that in some cases governments, upon the urging of you, have moved to allow some of your organizations to do home-based ART delivery. We know that that is happening in Laos and some other countries. One of your speakers talked about how there's now more permission to do 3- and 6-month ART delivery. So some of these challenges that we have with our HIV services, COVID has really pushed governments and allowed your organizations to move these HIV services forward in a way that perhaps would not have happened had the COVID epidemic not occurred. Still, I think hearing from many of you, there's still these continuing challenges with meeting HIV services. Many of your organizations have targets that are set by a donor, whether that donor is USAID or the Global Fund. And I think we all, in some cases, there's been flexibility on the side of these donors to realize that these initial targets can't be met, particularly during these times of COVID. But I think that still has to still be pushed and discussed very proactively with these donor organizations, that there has to be a lot more flexibility, not only with the services that you are being asked to implement, but also just in going beyond those services to reach, as many of your speakers have pointed out, the basic needs of these population groups. We've heard that many of them don't have basic shelter now or even proper nutrition, but it's very difficult currently now for some donors to allow their funding to be used for these basic services. And so I would encourage all of you to continue to communicate with donor agencies, or if you have intermediary organizations such as Linkages or FHI, where I work, that we help to be your sounding horns to speak to these donors about the basic needs for these population groups. I also want to just say I think we need to look towards a somewhat long future with COVID. Most of our countries here in the region continue to be very, very closed, whereby right now international travel is very, very restricted. I think that's not going to continue. Well, first, it will continue for several months more, but I think we might start to see an opening between some of our countries in the future. And what that will mean is that there will likely start to be more community transmission in many of our countries where we work. And what that will mean is that I think governments will start to need to be more open to community-based organizations having an even greater role in COVID referral testing or in doing testing themselves, because many of your organizations are already doing HIV testing. Some of your organizations already have gene expert machines. There are COVID tests that work on these gene expert machines. I know, for example, here in Thailand, that the organization Swing has already been asked to several months ago by the provincial authorities in Chonburi to collaborate with them in referring sex worker populations for COVID testing. So once again, when these countries start to open up, I would encourage you to work with the government and work with your own donor agencies to really offer what you can do in terms of testing and referral. Maybe if you don't have the capability to do testing, to work in active referral of your population groups that will really be at much, much higher risk than the general population for COVID. If you do have community-based testing capabilities, to proactively offer that your organization can actually get involved in doing COVID testing itself. So I think I'll leave it at that. Thank you again to AdCom for this opportunity for us all to discuss both these challenges as well as innovations. And I look forward to the next one that you will have in the next few weeks. Thanks.
Thank you so much, Steve. There are questions now coming in, but we will have time for questions. I may now invite Roger from the International Aid.
Thank you, Inat. Can you hear me well?
Good.
Okay.
Very well. Yeah.
Thank you very much for inviting me to be part of this webinar today. It's great to see organizations getting together, joining hands to raise awareness of the impact of the COVID-19 epidemic. I've heard many interesting things today. I took a lot of notes. I'm going to try to make sense of all of that. Clearly, there were some recurring and common themes talked about today. Anxiety, loss of income, impact on the livelihood, impact on access to the services, increased stigma, need for more skills to respond to this epidemic. At the same time, we have also heard that the civil society organization, the community-based organization, have been able to respond creatively and innovatively to this crisis. Services were adapted, and Steve talked about it. You have engaged with partner, donor, population. I think the question is, I think it's May, we mentioned it, this is the new normal, or what will be the new normal? What do we need to do next? What needs to be done now? And how do we approach the coming months, if not the coming year? And I'd like to make a few comments on that, if permitted, in the sense that we need to recognize the power of coalition. And today you brought together 5 organizations, and that's great, because that's important to approach donors, government in a united way, and to talk of one voice and engage as a group. Otherwise, government, donors can't deal with everybody, and they really like to have coalition where there are a number of people who may not all have the same view, but it's talking to one group. in order to have a meaningful dialogue, and that was said at the beginning, I think by Min, training is required. You will be much more successful if you understand the epidemics. You can bring the community voice, what the problems are, but if you want to bring answers, it's very important to get the training, and it's very important for donors to also provide that training, because it will not come out of nowhere. So I would say a literate organization which has the research understanding, the skills to discuss, to engage in this dialogue, is going to be much more successful. The demand, and I think we can talk about demand, needs to be very clear and very focused. And the framing of this demand, and May made a very compelling point about framing it as this is a human rights issue. This is access to basic services. And that's how it should be framed, in my opinion. And these have to be, realistic and practical. They have to be locally relevant and context specific. And Kunkop made some very interesting comment on how service user moved to real services to virtual services online, and that's great. But we have to be mindful that in some settings, access to the internet is not a given, and that's where having context-specific response needs to be thought of. The coordinated response also, and I think it's very important that it goes with the coalition. The response needs to be coordinated, and that's valid for community organization, donors, government. If everybody starts to do different things, this is not going to work well. And the power of coordination has been demonstrated already in the search for a COVID vaccine. And I think it's also important to think about the long term, and if there were a vaccine in, let's say, 6 months, 12 months, how will access be given? There are already coalition of advocates who have come together to discuss and address this problem. And it's, I don't know if you have followed the news, but Moderna, which is leading one of the main research on a vaccine, was doing a clinical study without people living with HIV. And thanks to people living with HIV getting together with other organizations, this has changed, and people living with HIV are no longer excluded from this trial. So this is this kind of little thing that are important. And finally, there was a mention of supply of ARV, of drugs. And here, I think something we often overlook is that we can engage with the industry. And actually, the industry, the biopharmaceutical industry, is quite keen to know what the community thinks. Clearly, we were taken by surprise by this epidemic. We shouldn't have, because we had one inside long ago. We were not prepared. All shipment, logistic is all done in the short term. And this is something the industry, and I know about that because I started talking to them, is keen to rethink. How do we make sure that there is no shortage of drugs? That's not just a government issue, but the industry has to think about that, and they are keen to engage. So I'm going to stop there, just reinforcing the message that you are doing a great job coming together, raising the issue, raising awareness. I would say keep going, and there are plenty of opportunity for us, all of us, to engage worldwide, because this is an issue that's affecting all of us worldwide, and we really need to link. I'm super happy to be here today, 6,000 miles away, and doing a small contribution. Thank you very much, Ina.
Thank you very much, Roger, for accepting the invitation all the way from Geneva. We are gonna go straight right ahead to the APCOM Executive Director, Midnight, to share his thoughts on these issues before we go to the Q&A. Midnight, Roger, to you.
Thanks so much, Inat. And I want to say thank you for everyone for joining despite the pandemic on a Friday afternoon or early morning, wherever you are. And thank you for joining us on Facebook as well. I want to congratulate and say thank you to the community speakers. So Min in Myanmar, and May in Indonesia, Kunkop in Chiang Mai in Thailand, and also Susanjay in Nepal for joining us and not sharing your experiences. I want to kind of like also acknowledge that the reason why we're here is because of we are able to reprogram some work on linkages. So linkages, as some of you may know, is looking to help communities to better access better quality and integrated HIV prevention, care, treatment services, and the support of people to access those services that are of good quality, and for those services to be safer for communities to then be able to access those services. And it's about evidence, information that empowers us, the key populations, including sex workers, men who have sex with men, transgender persons, and people who inject drugs, to then have the access to those services. So I want to acknowledge Steve and his team in FHI 360. And I also see that from the list of the participants, we also have FHI 360 staff from around the region as well. I also see that we have UNAIDS colleagues too who are joining us, so thank you for joining. And I think on the Facebook, we have some people from Global Fund as well. So it's really, truly not just Asia Pacific discussion. It's this is being reached globally as well. Oh gosh, it's raining here in Bangkok. I hope you can still hear me. My reflection I'll be very, very short. As Steve and also Roger has mentioned, a lot of the overlapping issues, and our community partners have already mentioned what were the activities that they could pivot and do, and then what are the kind of the main worries in terms of the service to reach the populations that they are serving, and other service needs outside HIV, outside health. So which is what APCOM has been really documenting, as Ina said, since April. We've been doing regular newsletter series, and we're now coming, well, this Friday we'll be launching our 13th COVID series, really looking at how the communities are responding or issues that the communities are experiencing during different stages of COVID-19. So Kunkop was able to talk more about, these are the things that they could do in Thailand, in Chiang Mai, because there's not a lot of restrictions, I think, in many countries in our region where the COVID-19 cases is still high and rising, and restrictions on travels will still be there. So we need to realize that some people don't also have access to the internet. So it cannot always be the same kind of interventions, but look at the local solutions in this time. Many of the community advocates talked about having the voice, being able to raise issues. And I think that is the most important thing that APCOM can also do within this platform, particularly around funding that is not going into services that the community needs outside the kind of HIV or health responses. So other services that our communities really need. Having the voice in this kind of advocacy so I mean, many of us talked about the CCM, that Global Fund, because that's something that we all understand and know the mechanism. As Steve said, there's also PEPFAR that covers 13 countries in our region. And so we want to make sure that our communities are able to then have those voices in terms of the issues and needs that the communities can have. So there will be a PEPFAR Asia specific call with the communities that we're hoping will be available at the end of September. So please do kind of like sign up onto APCOM's newsletter, go to our website, and so you'll get that regular updates. So and we'll be able to communicate to you when that will take place, so then you can take part in those discussions. There is on the regular newsletter series some kind of like emergency funding that you can also apply. Right now, there is one targeted at Southeast Asian countries. So I think there might be about 8 countries in Southeast Asia that are able to access that funding. So, I would say that, yeah, congratulations to the community organizations that are able to still provide the services, are still able to forge ahead. And, you are, I don't know where you get your energy from, I don't know where you get your inspiration from, but it's very difficult to deal both with the kind of demands of projects, and also deal with demands from your personal and also from your community's needs and understanding. And if you have other kind of like issues and ways that you want to voice your experiences, please do get in touch with Inad and or myself or other of the AppCom staff. We would like to profile your voices, issues, or even like your innovations as well in our regular COVID-19 series. So thank you, and thank you very much to Linkages for enable this webinar series to happen. And thank you, of course, to Inad and the team at AppCom for making this technology and invitations to everyone to join. Over to you, Inad.
Thank you, Midnight. Just to add on the things that AppCom is doing, so we are implementing our hashtag Corona AppCompassion. It's an emergency mechanism that the Secretariat has created through our voluntary donations. And we are still raising funds up to the moment. We just, some of our team just came from an activity supporting sex work in Bangkok. So if you have any ideas on how to raise funds for the emergency fund, because this actually goes beyond Thailand. We have supported Pakistan, 2 community organizations in Indonesia and India to make sure that those individuals who has lost their jobs or who were economically affected by the pandemic are able to meet their immediate needs and not waiting for any reprogramming of funds. So let's go straight to the question and answer discussions. I'll share my screen, and if you can, I have copied and pasted your questions. The first question is in Thai, and it is directed to M+. It's from Ed Ngoksin from the Global Fund CRG. This question is posted in Facebook. The second question is addressed to the donor agencies. How do we help expedite the delivery of procured ARVs to countries with high impact HIV? So when Roger has mentioned earlier in his time that in his speech that you know, it's not only a government issue but also a pharmaceutical issue. But then when the ARVs are procured, how can then we expedite that? And then how will the Global Fund indicator be assessed at the end of the year, considering that there is a pandemic? But I think this has already been addressed in the chat. And our friend from I think it was Roy who shared this, who shared the UNAIDS report, Roy Wadia. Thank you very much for sharing. And Roger has shared some links or resources for us. There is an available funding, or I'm not sure if it's still open. You can check covidadvocates.org and some resources on COVID-19 by the International AIDS Society. Okay, so let's start with the first question. M+ and Kun Pai-san, if you have anything to say.
ผมได้อ่านหรือยังครับ The question is, in addition to the online automatic booking, how do you collect data online? And is there a specific indicator that allow the program to know that they are actually reaching the targeted population, or are you just looking at the number of clients who come to the clinic? กบครับ คุณกบครับ
Okay, while waiting for Kun Kob, this is the issue on ART is very much prevalent in different countries. We have cases in Indonesia and we have cases in the Philippines where there is the people living with HIV are not accessing ARTs. We have received information from Bali and Jakarta about people living with HIV not accessing the ART. So the question is for the donor agencies. I think this, I think this is not just a question for donor agencies, but also to us, all of us here participating in this webinar. What are our thoughts in relation to this question? How do we make sure that the ARTs are expedited? Oh, does anyone want to share?
This is Steve. I might just add, it really goes beyond ARVs. I was on a call earlier this morning regarding STI kits. And because a lot of the world's production now of kits is really moving over to COVID. And so this is starting to affect production of HIV testing kits and STI testing kits. So I think, we definitely have to be communicating with supply chain specialists and those projects that really do have connections with supplies of all of these health-related products, because COVID is really burdening pharmaceuticals and other health product manufacturers with these other requirements now.
Thank you, Steve. Thank you, Steve. So we have another question. This is from Mongolia, actually, from Bell, our friend from Mongolia. How will the Global Fund indicator be assessed at the end of the year? Due to the pandemic, the organization is at increased risk of not reaching the targets. But our friend from the Philippines, Jeff Domingo. Jeff, you have typed in your suggestion. Would you like to share it to everyone?
What we did in Network Plus is that during the onset of the pandemic last March, we already sent an email to the Global Fund country manager requesting for the realignment of funds, at the same time managing the expectations of targets, so that we could be able to comply with the given definitions of the Global Fund for this year. We got a response already from the country manager that they're acknowledging the concern, and that they have already realigned some of the funding for COVID response, and at the same time for the HIV program. And at the same time, the targets have also been managed. We are now looking at a more on community response towards the pandemic. Thank you.
Thank you, Jeff. And we also have a question from Pakistan, from the Richa Male Health Society. How do we reach the clients in remote areas, as there are ART centers only in the major cities? During COVID, they tried to work with some government organizations to get ARTs via courier services, but it was very hard. Sometimes it doesn't reach those areas either. So does anyone have experience related to the issue? Yeah, Sanjay.
Yeah, we are working through the PEPFAR project now, and we have a community-based ART. We are lobby with the government and National Center of Nepal to do the community-based ART. So community member like PN Navigator, we hire the PN Navigator through this project, and PN Navigator is looking after the clients who have ART, who have stock or not, who is running out. So that person will be get ART from the government office like hospitals, and they give them to deliver their home. From PN Navigators will be going to deliver to their home through our online outreach and CBS and peer navigator. This practice we are doing now. For now, further action, we are talking to government of Nepal to give some ART to the community people who is working for the NGO as a CBART, community-based ART. So it's very helpful to deliver in those kind of the pandemic situation. These are our practices.
Inad, may I share for the Philippines?
Of course, Jess.
What we also did in the Philippines is that we were able to present a draft of a guideline on ART services as well, or HIV services guideline during the quarantine, community quarantine, wherein part of the guideline is that delivery or access to ARV should be communal, meaning to say if the person's hub is in Manila, but he is currently in a province, he can access ARV refill at that province treatment hub. And that this is a mandate from DOH that all hubs, all treatment hubs must accommodate all PLHIVs for their refill access wherever they may be. At the same time, for those who have for those provinces with local courier service, like what we have in NCR, like Grab or those motorbike couriers, they have been partnered with to deliver ARV at the same, to be charged to the government's PhilHealth program, so that there will be no cost to the PLHIV in accessing ARV through courier service. Also, like what other community organizations are doing in the provinces, the volunteers are also being moved or organized to help in the access of ARV through with PLHIVs by being for them to pick it up in the treatment hubs and deliver it to the clients. Thank you.
Thank you, Jeff. We have a very interesting question addressed to the community. And thank you for this question, Sudarwanto, for like this. What? The question has actually been sent prior to the webinar. And I have sent this to May and to Min and to Sanjay. In these times, the community-based organizations are metaphorically like a bristle or straw broomstick with a very weak thrust and leverage. Is there any constructive and applicable advice for CBOs to be united like a broomstick that will collectively sweep away the current developing issue, including COVID-19?
I will try to answer the question, Inat, but yeah, this is only some of my thought, and okay, I'll try to answer it. So I think the first step for us to be united is we have to be more inclusive, I guess, because I think until now, especially for the HIV community, we are very exclusive, and it's time for us to be inclusive. And we try to accept and understand the different characteristic or diversity of the community-based organizations. I think we need also to ensure that all the socioeconomic or ethnic groups or communities with other issue related to the health issue or HIV or COVID in our community are represented. And I think also it's a very good strategy if we start to engage at the first step is to gather all the community leaders from each of the organizations. So engaging them, I think it's the best strategy. So we try to be more inclusive, engage with the community leader, and then the other way to make us more to become united, it is very important step for us to active listening. I mean, we have to listening to everyone's concerns and also needs. because I know every community-based organizations have their own different point of view, and the best for us to build the trust, to open our heart and our mind, is the best is to listen and empathize, even if we not really agree with their point of view. And then it is also very good, like what OPCOM already did, to maintain the communications, coordinations in formal or informal way. At least to become more united, we have to take the first step to be inclusive, more engaged with the leaders, to be active listening, and also maintain communication and coordinations, and also maintain the authenticity of each of the community-based organizations. Because if we are truly involved and accept the truly diverse of community, so I think the best ideas, the best understand will raise, and we will have the same understanding, and we will reach the same goals. I think that's my opinion, Inat.
Thank you, May.
Thank you.
And we have Rojicel. I'm not sure if I got your question correctly, but please.
Hi. Thank you, Enid, and thank you, May, as well. That is a very strong message. I am Rojicel. I am from the Philippines. I've been working in the HIV program for like 5 years now, and right now I am working with in a COVID project under an organization here in the Philippines as well. And this is just quite an insight regarding the last question raised here about how CBOs will be united. I would say we just need to simply find our common grounds. So we are different organization, and we have different advocacies. But I think common grounds for every organization are actually providing service to different target populations that we want to help, and that is a very strong common grounds for all of us. We might have a different advocacies, we might have a different programs, but in the end, it is service that actually make us all the same. We want to provide service, we want to provide help to a lot of target populations that we want to help out. And amidst the COVID-19 pandemic, it is really hard, most especially, let's say, for example, here in the Philippines, it's hard for all of us to move due to a lot of restrictions of community quarantine or lockdown. Of course, the risk that you might get, the risk that you might acquire the virus outside. But it all boils down to your compassion and your passion to extend help and to help these people that we target. And it is very important that we should not lose our passion on what we do. I think that is all that I wanted to share, and thank you for all the speakers that provided a very fruitful and very strong point of views and insights for today. Thanks.
Thank you, Rojicel. Now I'm going back to the first question. Kun Kob, before we wrap up the webinar, Kun Kob Kap.
ครับผม
Kap, first question ทำงาน if you have answer.
คือเรามีการเก็บข้อมูลนะครับก็คืออย่างที่เราบอกว่าคือเราพัฒนารูปแบบการทำงานออนไลน์ในช่วงสถานการณ์โควิดนะครับคือมันเหมือนเป็นช่วงที่เราได้ทดลองระบบแล้วก็ได้เก็บข้อมูลช่วง3 เดือนที่ผ่านมาอะไรอย่างเงี้ยครับเราใช้เว็บ Test Me Now นะครับที่ใช้ในการทำจองเนาะแต่ว่า เราเองก็อยากจะรู้ว่าคนที่เจ้าหน้าที่ภาคสนามนะครับเขาสามารถที่จะเข้าถึงหรือว่าลิสต์ได้เนี่ยเขาลิสต์มาจากช่องทางไหนผ่านเจ้าหน้าที่คนไหนเลยครับใน Test Me Now เนี่ยครับมันจะมีลิงก์ให้กับเคสหรือว่ากลุ่มเป้าหมายของเราเนี่ยเขาได้กดจองซึ่งลิงก์นั้นนะครับมันก็จะมีรหัสที่เรียกว่าโทเค็นนะครับเป็นของเจ้าหน้าที่ภาคสนามอันเนี้ยมันก็จะสามารถเช็คได้ครับว่าเจ้าหน้าที่ภาคสนามคนนั้นเนี่ยเขาทำงานเข้าถึงกลุ่มเป้าหมายเนี่ยในแต่ละเดือนนะครับมากน้อยแค่ไหนแล้วเราเองก็อยากจะแท็กด้วยว่าครับช่องทางที่เขาทำงานเนี่ยครับมันสักเซสแค่ไหนมันเป็นช่องทางที่ค้นพบคนที่มีความเสี่ยงคนที่มีพฤติกรรมเสี่ยงครับอันนี้เราก็แท็กจากช่องทางออนไลน์ที่เราทำงานอย่างเช่นFacebook Hornet Twitter หรือว่าแอปพลิเคชันต่างๆที่กลุ่มเป้าหมายของเราครับเขาใช้ในการพูดคุยหาเพื่อนหาคู่นะครับอันนี้ก็เป็นการแท็กโดยที่ตัวรหัสของลิงก์จองของ Test Me Now ที่มันจะมีรหัสของเจ้าหน้าที่ทำงานและก็จะมีโค้ดที่บ่งบอกว่ามาจากช่องทางไหนครับอันนี้จะเป็นการแท็กข้อมูลตรงนั้นส่วนอีกอันนึงก็คือแล้วเราจะรู้ได้ยังไงว่าช่องทางนั้นมันมีประสิทธิภาพหรือว่าเป็นช่องทางที่เราเข้าถึงกลุ่มคนที่มีความเสี่ยงนะครับใน Test Me Now เนี่ยมันจะมีการบันทึกข้อมูลผลแลบผลเทสนะครับของแต่ละผู้รับบริการในคลินิกนะครับอันเนี้ยมันก็จะเอาข้อมูลของเรื่องของการเทสเรื่องของการทำงานลิสต์ต่างๆครับเอามาเชื่อมกันแล้วก็เอามาดูครับว่าช่องทางไหนที่มันมีประสิทธิภาพเจ้าหน้าที่ภาคสนามคนไหนที่เขาเข้าถึงแอปพลิเคชันนั้นแล้วมันสามารถเข้าถึงคนที่มีความเสี่ยงสูงได้ครับอันนี้เราพัฒนาจากการที่ในช่วงสถานการณ์โควิดเนี่ยครับเอาข้อมูลของ3เดือนเมษาพฤษภามิถุนายนนะครับเอามาวิเคราะห์ดูแล้วก็เอามาออกแบบกิจกรรมซึ่งก็ได้ข้อมูลอะไรหลายๆอย่างเยอะเลยที่มาช่วยพัฒนางานในปีถัดไปครับผม
Okay. During the last 3 months, we have used Test Me Now website for the online booking for services at the clinic. And in this website, when a client wants to book for a service at the clinic, they will have to use the token provided by one of our outreach officer that allow us to know how many clients each outreach officers can reach during that time period. And also in Test Me Now, it allows us, the clients, to also identify which platform or applications they have been reached by, whether by Facebook, Twitter, or Hornet or other dating applications. And also the website Test Me Now also allows us to include the test results of each client, so we can cross check the test result with the outreach officer and also the applications to identify the most effective way to reach the clients, especially those who test positive. So based on this website, we have design new activities to serve this population online and also to conduct more effective outreach activities. Thank you.
Thank you so much, everyone. Thank you so much, Kun Kop, Kapun Kap, and Kun Paisan. And to our partners in Indonesia, terima kasih. To Min, Tet Pilsan, Jasuba, and to Sanjay, thank you. I don't know how to say it in Nepalese. Namaste. But my key takeaway for this webinar is that this goes beyond HIV. We are looking into the basic needs, the essential needs of the constituency that we serve. And another key takeaway is that all of us here in this webinar session, all 49 of us, are very passionate to serve and to save lives. And I think that should be one key goal, as Rochelle has mentioned, one key thing that we need to work with. And as May has mentioned, it is time to be united and to be inclusive, and it should start from ourselves. Thank you so much, everyone. I know there's a lot of people who wants to join in the discussion, but kapun kap, salamat po, Jasuba, terima kasih. And thank you so much. If you have any questions, please do send your questions to appcom@appcom.org. We will be keeping in touch with you, with the registered participants on the speeches of and presentations of our guests. And please don't hesitate to reach us. Thank you so much, and we will see you again in the next webinar on September 11th. Thank you. Bye-bye.
Thank you so much. Bye-bye.
Terima kasih.
Kapun kap.
Bye-bye. Khop khun krap.
Namaste.